Hello and welcome to Niaga Spotlight with me, Tamina Kausji. Niaga Spotlight goes through the week in business and future affairs, market watch, industries, analysis and insights. We've got you covered right here on Niaga Spotlight. Well, this week on Future Affairs, we take a deep dive into a most timely topic ahead of Budget 2024, being tabled on 13th October. Now, 1st of October is International Day for Older Persons, or IDOP. The 2023 IDOP theme is fulfilling the promises of the Universal Declaration of Human Rights for older persons across generations. Now, Malaysia is officially considered an aging country as the total population aged 65 years and above reached 7.3% in 2022, which is 2 million adults. By 2040, it will be 6 million above 65. This rapid growth in the aging population underscores the significance of promoting health, socio-economic participation while preventing and treating illnesses through the life cycle. Joining me now in the studio to discuss healthy aging as part of the broader Malaysian economic landscape are Datuk Dr Narimah Awin, Technical Advisor on SRH with UNFPA Malaysia, former Director, Family Health Division, Ministry of Health Malaysia, as well as former Regional Advisor for Southeast Asia with the WHO, as well as Associate Professor Dr Halimatus Sakdiah Minhat, who is Director with Malaysian Research Institute on Aging, MyAgeing at Universiti Putra Malaysia. Thank you so much for making time to join us in the studios. Dr Narimah, Dr Halimatus, how are you this morning?
Fine.
Okay, wonderful. So if I could get started, Dr Narimah, by asking you about when it comes to Malaysia's aging population, what are some of the challenges regarding socio-economic participation, social mobility, particularly that have been observed due to COVID and post-COVID impacts?
I will start by saying the most basic fact, that is, as a country ages, so the proportion of aged people, like you said, 7.3% in absolute numbers is also very large. That means the younger population, the younger people who will continue earning and support these older people, that population is becoming smaller. So the first implication is the national economy is now a bit imbalanced because more older people. The second point is that older people tend to have more morbidities. They have cardiovascular disease, they have non-communicable disease and other diseases, disabilities. Therefore, the economic burdens of having a large aged population is high. And if you talk about the COVID that happened 3 years ago, post-COVID, even during COVID, one of the implications, that because we in UNFPA, we did a study of low-income families. What were the economic and health implications on these low-income families? We studied 500 families. It was very clear that the elderly suffered because the younger, say the daughter-in-law, the younger people who were earning for them are not going to work anymore, so loss of income. So the elderly became more or less, well, I might be exaggerating, but say neglected, because now the smaller pie, the little money that the family has will have to be divided into more members of the family because they are not working anymore. And remember, the children were not going to school. So children who were, for example, getting free meals in school were now at home. So the elderly population in that family became directly impacted because of COVID. And now for post-COVID, we'd like to know, have these families recovered enough? So we will be doing another study, inshallah, very soon. UNFPA will conduct another study with the low-income families on the impact of COVID, including on the elderly.
And definitely not forgetting the intersectional impacts when it comes to being elderly as well. Dr. Halimatus, moving into MyAgeing's perspective when it comes to Malaysia's aging population, what do you feel are some of the most impactful socio-economic challenges that have been observed, especially during the past year?
Okay. When we talk about implications of aging or consequences of aging populations in general, there are three main domains that we have to be aware of: the social domain, the economic domain, as well as the health domain. And we are all aware of all these impacts even before COVID-19. It's just that the magnitude of the impact becomes larger post-COVID because, as we know, the older person are the most affected during the COVID-19 in terms of mortality, morbidity, as well as the economic impact is, by itself, because as we know, Malaysian in general has not very good in terms of retirement saving, I would say.
Correct.
probably implicate the whole thing during the pandemic on its own, as well as the social implication as well. So we cannot actually separate this domain. When we talk about implications of aging, we cannot separate this domain individually because they are very much interrelated. And when you talk about health, it has an impact on the economics as well in terms of adherence to the healthcare services, the economic burden when it comes to getting the correct, the best services, the healthcare services, as well as the social impact in terms of the caregiving part, the long-term, the short-term care services. So all these things has to be taken into consideration and planned accordingly by taking all these domains at the same time. So we can't really say economic is the main issues at the moment, the social domain is the main thing, or even the health. It has to be incorporated and planned integratedly, I would say, taking care all these domains at the same time.
Correct.
Yeah.
I really appreciate the fact that you're able to offer that holistic overview, and economics, of course, is always integrated. Dr. Narimah, moving back into the fact that senior citizens, despite being so affected, they do not actually receive any specific budget allowances or assistance. Let's talk about what would be some good ways to ensure that those who are already fallen between the cracks, particularly vulnerable elderly from B40 backgrounds, what would perhaps be the way forward?
Chamina, I think this is an opportune time for you to ask this question, knowing that the budget is going to be tabled in October. Now, if you look at the budget of the agencies that are directly involved in caring for the elderly,
Sure.
the Ministry of Health, the Ministry of Women and Family Development. So the budget that they get under the public health program, under the family health development program, they have an activity, because I was a director there once upon a time, the amount of money given for the elderly is so much, because the pie is only that much. So if we can have a bigger pie, if we can have policies that support the elderly, because this is going to be an increasing problem, that would help. So in terms of budgetary allowance, I would really appreciate it if money is earmarked for healthcare of the elderly. For example, does the Ministry of Health have enough geriatricians to work in the hospitals? Do we have enough gerontologists in the public health sector? Do we have enough nurses who are specially trained in caring for the elderly? So that extra budget would come in very handy, and I think we really need a very strong policy on the financial investment into care of the elderly. We don't have much time this morning. I would like to have more time, but I think time is so limited that we should, for example, now MyAgeing is a research institute. Perhaps
That's right.
you already have, Halimatus. I would like to see evidence, robust scientific evidence, to advocate to the government that you invest RM1 in care of the elderly, you will get a dividend of maybe RM3, RM4, whatever, what we call return on investment. So if we have evidence on that, and I've seen evidence from other countries, like there is very strong evidence, I think it was in one of the European countries, that community-based prevention services brings in a lot of dividends. So I would be very, very pleased to see a bigger budgetary allocation to the ministries that care for the elderly, the Ministry of Health being one of them. And of course, the Ministry of Women, like LPPKN under the Ministry of Women. I was a chairman there once upon a time. We have programs for the elderly as well.
And thank you for sharing that. Plenty more to delve into. But one thing that I'd like to zone in on, Dr. Narimah, is, as you said, community-based preventive. What would that look like on a practical approach?
Okay, the word community-based has a very broad meaning. So far, when we started primary healthcare in 1978, the convention was in Alma-Ata, we began to talk about empowering the community and getting the community to participate. So the Ministry of Health was very responsive in that. One of my most successful community-based program in health was actually among the elderly. I had one in Kedah. And I remember that Tun Mahathir and Tun Siti Hasmah came to see my clinic because it was a very successful aging program, community-based. And one I had was in Seremban, where the elderly were encouraged to come to the clinic and they give each other peer counselling. My doctor was there trained in elderly care,
Right.
and I invested money to buy, say, the exercise machines. So they had both medical and social intervention. So that's community participation, community-based program, although led by the health clinic. So that's one example. The one that I read recently on the evaluation of the financial implications of community-based care was, again, I can't remember whether it was led by the doctors, but it was within the community where they help each other to do healthy living, healthy lifestyle. You know, talk about diet, talk about exercise, talk about mental health
Stay
maintenance.
active, yeah.
And it was very, very cost effective.
Very interesting. Dr. Halimatus, I would like MyAgeing's perspective on whether there is enough awareness by and large amongst Malaysian society about a lot of the challenges when it comes to aging, considering especially the fact that all of us are aging daily, right? It is only a matter of time before every single one of us will also be faced with those same challenges unless we address them today.
I would say among the aging community in Malaysia, most of them, they are well aware in terms of the consequences of aging, as I said just now. But I suppose we actually have to tackle aging issues according to the life stage. If we were to create better awareness, better knowledge, better literacy in terms of the implications of aging. So this is something is lacking at the moment. We do have curriculum, for example, in terms of aging consequences, aging-related change, physiological, in medical curriculum, or even in the social sciences, but not so much in the schools, the primary and the secondary school, or even in the kindergarten. There's something that has to be integrated and incorporated if we were to face an aged nation in 2030. As you said, we're going to be an aged nation in 2040, something like that, 2035,
yes,
if we were to go by the 65 years old cut-off point. But we are still using the cut-off point of 60 years old. Most of our policies when it comes to aging is still using the cut-off point of 60 years old. So if we were to use the cut-off point of 60 years old, we are going to become an aged nation in 7 years to come. So something is urgently needed in terms of creating awareness for the nation, and it has to start as early as possible, from womb to tomb, I would say, especially among the younger generations. Because in my opinion, the awareness is not there yet in terms of what they would be facing when they become an older person, 60 years and above, as compared to probably better awareness among those who are already in the aging group, in the 60 years and above population. So awareness, education in terms of what to expect in the future is something that has to be taken seriously, and this has to go across the life cycle or the life course.
Speaking about across the life cycle, Dr. Narimah, so when it comes to the future of elderly care, you were speaking and referring to the lack of geriatricians and primary health physicians who can focus on the elderly population. What can be done to expand that baseline to ensure that the elderly population we do have does stay healthy, active, and also for longer?
Okay. This is very much related to what Halimatus just said, and I'd like to repeat what she said. I'd like to reiterate the two words, life course perspective and the womb to tomb. Because when I was director in the Ministry of Health, I really tell people, I look after people from womb to tomb. Right from the time you are in the womb of your mother, antenatal care, to the time that you need palliative care as a very, very oldest elderly in the home or in the hospital. Now that is very important. For example, not just the nutrition of the mothers while she was pregnant is important for this newborn baby to become a teenager, to become an adult, to become an elderly. For example, I was very disappointed when I was a little younger in the ministry about the breastfeeding rates. Mothers were not breastfeeding enough, and we've got very robust scientific evidence to show that among the elderly of today, those who were exclusively breastfed when they were babies are doing much better. So things like that, interventions very early in life, newborn care for this, or for that matter, when the child is in school. So I like to repeat what you said, Halimatus, that the education system in the primary school today does not give enough knowledge to these children about the importance of a healthy lifestyle that will maintain your health throughout life, that will make you into the elderly. Then I come to your question, Tamina, that once they are elderly, I mean, too bad, some of them will have many of them will have non-communicable diseases, many of them will be disabled, many of them will be senile or even having dementia. That is when it's a bit too late already, but we need to intervene. So that's where the health system comes in. We should have enough geriatricians, enough gerontologists, enough family care, family medicine specialists who really know how to look after the elderly. But that's the end of the cycle. If you give me one more minute, I will talk about what we call the compression of morbidity. What does compression of morbidity mean? It means that if I reach 80, I would surely get dementia, or 85, or I get high blood pressure. Can I live a life that I will have it not at the age of 80, I'll get it when I'm 95? Can I compress that morbidity to older age? That's where the womb to tomb and the preventive lifestyle, including breastfeeding and child nutrition, comes in. And that's where once they become older and they already have the disease, the clinical intervention by the geriatricians come in to delay, if possible, further deterioration of the condition. So you compress the morbidity, they get it when they are very old, not when they are what we call the young old. It should be the old, yeah.
So those are two such fascinating insights, right? All the way from looking at the life cycle approach. And I think it's particularly important because in the post-COVID economic recovery period, what we've really observed is a lack of basic nutrition for the children of today. Now, you're saying that, of course, that will impact how our life cycle outcomes are when we are in our 60s, when we're in our 80s, and the compression of morbidity. Dr. Halimatus, from there, I wanted to move into a point that you had referred to earlier about balancing the fact that a lot of our elderly do not have enough savings, particularly for their EPF. So what are some ideas or some research perhaps MyAgeing has been working on to look at closing those gaps? Because one thing that is certain is the necessity to have a basic support income-wise, especially once you're elderly and no longer working.
Okay. At the moment, we are closely working with QOP, not so much with EPF. And when we talk about QOP, it's very much related to the public pensioners rather than those who are actually dealing with EPF. But again, if you look at statistic, 1 in 4 older persons are actually 1 in 10, I would say 1 in 10 of older persons are actually still financially supporting their family members, and 1 in 4 are actually very much depending on financial support from the children. So that's how it goes at the moment. When we talk about poverty, it's very much related to the older person, especially among those who are retired. So, and again, it actually linked to the fact that something needs to be done when it comes to financial literacy and financial awareness. So at the moment, especially among those who are from the public servant, public pensioners, they are very much depending on the pension scheme. What we need at the moment is a variation in terms of saving. So it should be flexibility in terms of saving, not just 1, probably 2 or 3, to actually cater the post-retirement period in terms of financial needs of the older persons. And on top of that, I would say they are not very much aware in terms of the economic impacts, because if you talk about B40 just now, or those of the disadvantaged financially, they are very much dependent on the financial support from the government. So we have to shift the mindset from actually receiving from the government from time to time, from something like probably post-retirement employment, bridging employment. But again, the issue here is not re-employing them, but the opportunity. Do we have opportunity to actually re-employ the older persons? Survey that we have done, most of them, especially those of the lowest socio-economic status, those are the most in need of post-retirement employment, because they can't afford to retire. They still have financial commitment. But do we have platform or opportunity for re-employment for this particular group? Because at the moment, if we see those of the professional group wouldn't have issues in terms of post-retirement employment, but they might not be the most in need of financial security in the end. So again, reskilling, upskilling, training, something that needs to be considered. But do they actually want to be reskilled? Do they actually want to be upskilled? So surveys needed, market surveys are needed. You know, you have to actually explore in terms of which particular group that has to be targeted in terms of re-employment post-retirement, and then in terms of employer as well, do they actually want to re-employ older person above 60 years and above? Because
so, Dr. Halimatus, I actually see so much of opportunity to delve a little bit deeper into some of those issues you've just arised. But we do take a quick commercial break right now. We'll be right back with Niaga Spotlight. Don't go anywhere. Welcome back to Niaga Spotlight with me, Tamina Kausji. Today, of course, we're focusing on IDOP 2023 ahead of course, the Budget 2024 tabling with Dr. Narimah and Prof Dr. Halimatus in the studios. Dr. Halimatus, as you were saying earlier, now one of the key components of whether it comes to re-employing or having those who are elderly and retired back in the workforce is qualitative data. Why is it so important when it comes to the time before rolling out programs?
Because older person, they are not all the same. It's involved huge spectrum with huge difference in terms of needs, including the needs to be re-employed. Not everybody wants to be re-employed, and we actually have to see in terms of their health condition, their mobility, their physical ability, their mental ability, because these will have a huge impact on the individual industries and sectors and company that makes the willingness of the employers, I suppose, whether or not to re-employ older person above, beyond the retirement age. So a lot of things has to be considered in that sense, because I suppose not many employers in Malaysia at the moment are actually going towards re-employing older person. Especially among those who requiring upskilling and reskilling, I would say. The other thing that they have to consider if they were to actually re-employ older person post-retirement age, in terms of intergenerational workforce. Not every single older person capable of working among those of younger age, and vice versa. So we always think about the younger persons incapable of working together as a team with older persons, but again, does older person capable of working with the youngsters as well? So a lot of things has to be taken into consideration, especially the employment policy as well, flexibility, working hours, ergonomic condition, everything, not just physically and mentally. They might not be able to work 5 days a week. Probably something needs to be done in terms of hours a day, number
flexi
of days
hours
away.
and flexi days, exactly.
Or probably certain medical leave, family leave, for example, because they
or
have
even perhaps there's grandmaternity leave.
Yes.
Dr. Narimah, any insights on that and your thoughts?
Okay, Halimatus, thank you so much for giving us a very broad overview of that. Now we are going into what I call the double jeopardy. You are vulnerable because you're old. But if you're old and you're poor, you have the second vulnerability. Being old is bad enough. Being old and poor, it's not nice. If I add in the third factor, we come to the triple jeopardy. Let's not talk about that now. That's the gender part.
We'll come to that in just a bit.
Being old, being a woman, and being poor. Now, what you have just said, Halimatus, really brings home the point that you make a lot of statements for which we don't really have evidence on all of them. So a lot more research, a lot more comparative studies need to be done. For example, before you go into reskilling, would you want to support extending the retirement age to 65 or 70?
Correct. There were fierce protests in France this year.
Look what happened to France. The government almost fell. So I was quite surprised that the French overall really do not want to work until a much older age. They want to retire early. I'm not sure what Malaysians prefer. But I know of the fact that many younger people will resent it. Oh, I was waiting to be promoted. Now you're keeping this KSU or this DG longer. So there goes, I have to wait longer. So there are so many implications. But I think we should not write it off. Do we have enough evidence to say yes or to say no to extended retirement age? Then comes the reskilling. It is said if employers are unwilling to employ older people for whatever reason, for all you know, they're just baseless prejudices. Well, I'm 73 and I'm still working. So if you look at countries like Japan, where the awareness on the needs of income security for elderly is so high. So there are a lot of policies that go hand in hand.
And that's
for
perhaps due to
Australia.
the fact that Japan in particular has such a ultra shrinking base of young people working due to the ultra low birth rate.
Yes, because the lifespan is so long. In Australia, at one time, when I went for a meeting in Australia in the year 2000 or 2002, long ago, I was told that in the state of South Australia, there was no retirement age. You cannot tell a person, you have to go off from work, or you have to stop working because you're 70 years old. No, you can't do that. By law, you cannot do that. You can say, sir, you have to cease working now because your eyesight is not good anymore. Your hearing is not optimal anymore. And I think you're getting a little bit of, you're losing your memory to some extent. So you have we have to phase you out of the workforce. So I think there are many options. I mean, this is a very interesting. We need hours and hours to talk about this. But I think the government needs to think about this, get the evidence, what works best in the Malaysian context. Like in France, it didn't work. Extending retirement age did not work. I don't know, it might work here.
And we still have one of the lowest retirement ages.
It has to be targeted, I would say.
And with this revolution in the technology world, with so much of computerization, of digitalization, I think there's a lot of reskilling the elderly people. And I'm a very good example of that. I'm so technologically inadept that I would find it difficult to get employment in a place where technology is the main mechanism.
Sure, but there has to be a way to bridge that, because those from the elderly professional backgrounds, they also bring so much of skills as well as work experience that enriches the workplace.
The experience.
And moving on from there quickly, Dr. Halimatus, thank you for that, Dr. Narimah. We also do have a mindset that shows from surveys done limited in the Malaysian market that is the duty of the young to care for the elderly. Now, however, this also does tend to limit the development of social services that specifically cater towards our elderly. What are MyAgeing's thoughts on shifting this perspective? And we particularly now, we're actually seeing a lot more intergenerational homes with the sandwich generations. Parents who are also taking care of young kids, but at the same time are also in place, have elderly members of the family who of course prefer to age in place.
I don't like the idea of putting all older person in one place and the younger people in another place.
It's segregation, right?
Yes, they should be a good mix in terms of older person and the younger people to create better understanding, harmonization, and to actually reduce stereotyping and stigmatization towards older person. So what we do at the moment, we are providing, yes, that is actually good initiative, providing the long-term care for those in need, but at the same time, we are also seeing a lot of older person who are being abandoned from hospitalization. There was nobody to actually fetch them home and end up in the nursing home, for example. Something that has to be considered seriously, in my opinion, is aging in place. They should be allowed to actually aging at their own house, providing the environment is conducive enough, having a neighborhood who are actually very supportive, having a home that probably having all those equipment that can support active aging in terms of gerund technology, the assistive devices, and now I suppose in most of the countries who are already aged, they are going towards telemedicine, home help services. There's something that we have to venture at the moment. At the moment, we do have home help services under JKM, Department of Social Welfare, that has been improved from time to time. But again, strengthening would be needed. Expanding it is also an issue as well, and probably to actually involve older person as volunteers as well. So there are lots of older persons at the moment in Malaysia who are still capable physically in terms of providing services for home help services, for example. And the other thing is that when it comes to caregiving system for the older person, whatever the institutional care that we have at the moment, it should be not replacing the traditional caregiving system that we have, whereby children are looking after their parents. It's just complementary in terms of we are actually adhering ourselves towards whatever services that we have to actually provide a better care, better quality of life of our parents. It's not actually replacing, I would say, because that's not how it works at the moment, but it's actually happening.
Yeah, it should be a mix and match, ideally speaking, of many different options so that each family can sort of cater what fits them best as well as their economic realities, right? Dr. Narimah, I think now would be the perfect time to go into the triple jeopardy that you mentioned earlier and focus a little on elderly female poverty, given the fact that, of course, our women also generally live longer than men. At the same time, there is a noted lack of savings when it comes to elderly women in Malaysia, up to 30% less when it comes to EPF.
Yes, certainly. Now, what Halimatus was just said and what you have just said, Tamina, really has relevance to this triple jeopardy that I'm talking about. You were talking about let's not institutional care take the place of family care. And we've always taken pride, oh, we are the Asian culture, we look after our parents, unlike the Europeans and the Westerners. The Indians were very much into joint family. I went to Bangalore several years ago and I saw parents were uncared for because the children have migrated. So they needed some kind of institutional, community-based
infrastructure.
Care. Now, if you're a woman, you were talking about a woman looking after the children in the family and looking after the elderly. In the study that we did under Families on Age with UNFPA and UNICEF of the COVID, we saw a woman, say a woman who is 50, well, she's not really old yet, say even a woman of 60, has children to look after, grandchildren to look after, a mother who is 80, and perhaps a grandfather who's 90 plus.
Right.
So this triple or quadruple generations in the family is a huge burden on the woman because let's face it, informal caregivers are hardly ever men. If there is a healthy man in the family, it's still the woman doing this. And in that study that we did, these were the makcik Kia. These were the women who went out every morning to sell nasi lemak and goreng pisang. Now because of COVID, she cannot do that anymore. She has 3 generations to look after. So this poor woman, she's a woman. By being a woman in a patriarchal society, she is the caregiver. She looks after everybody in the family. She is poor and she is old herself. So that triple jeopardy is becoming a harsh reality. I may be a bit audacious, Tamima, to say that in the new budget, if some...
What would be able to make that intervention?
Out of the box.
Sure.
I don't know how doable this is. Could there be some national policy to say that women who are doing this kind of job and who are really, really suffering economically, socially, mentally, they had very bad mental health as well. Could there be a system of social protection from the government? I'm not an economist. As simple as giving these women some kind of allowance every month, say.
A social pension scheme specifically?
Yeah, it's like the dole in Western countries. Like in Australia, if you give birth to a baby, you straight away get $300, because you're giving birth to a baby. Can something like that be given from the government coffer to help these women who are facing this triple jeopardy of being a woman, being poor and being old, to sort of reduce a burden a little bit?
Exactly.
I think it's not an impossible dream. We should consider that.
Any thoughts on that? A social pension scheme perhaps, Dr. Halimatus? Would that be appropriate and timely? And what could perhaps a monthly budgetary allocation be for every elderly person, specifically for those still doing caregiving?
In the end, we have to think, what would be the best pension scheme for our nation? Would it be contributory or pay as you go, what we are having at the moment? And when we talk about effectiveness of any pension scheme, we have to go in terms of the breadth and depth. The breadth is what the World Bank is actually currently proposing, the framework, the multi-tier system, as well as the depth, whether it's adequate, whether it's sustainable, and whether or not it's actually equitable. So when it comes to equitable, that goes where the housewives comes in, or the gigs economy people comes in. So we have to actually look into a bigger picture. So the current trend in most of the developed countries at the moment, in order for them to cater these 3 components, adequacy, sustainability, and equitability, they go towards universal coverage. So the universal coverage, you are actually applying the life course and life cycle approach in providing a better social protection for the nation. So you go across in terms of from childbirth, from adolescence, from adulthood, and the gender element has to be incorporated at each of this level. Then only it become realistic, I would say.
Exactly. And Dr. Narimah, if we could focus quickly on, as we move towards closing out the discussion, the importance of focusing on dementia and dementia prevention as well as treatment when it comes to our elderly population.
I think this is one of the areas that is rather neglected, because from my observation, this epidemic of senile dementia was rather sudden. And on top of that, we had Alzheimer's coming in. I mean, younger, not very old people, younger people getting dementia. So dementia is a reality, a harsh reality of life. You want to add years to life, can you add life to years? That's the important thing. You want people to live long, but they must live long in good physical health, emotional health, social health, and mental health. And senile dementia, it is just the biology of aging. Is almost unavoidable. You can't live until the age of 100 without losing your memory. But I think there should be modalities of dementia prevention. I'm not very well versed in this area. But again, going back to what you were saying just now, Halimatus, I was just thinking about the lack of evidence we have at the moment. So we need to have really more evidence, more rigorous research to see what works best. What is the best prevention of dementia? And looking at what you were saying just now, economic, financial security among the elderly. What are the best models? Is it pension scheme? Is it EPF? Is it community-based or is it specific budget? So I think if we can do a desk review, if I'm MyAgeing, I'm sure you have done some of this, to do a desk review or a meta-analysis of what works best in other countries. Let's look at best practices. So I think there are best practices in many countries on prevention of dementia and management of dementia. So that's when now not only we have geriatricians, when before I retired, I had a lot of very committed psychiatrists who were super specializing in elderly care. So I had a psychiatrist who treated only old people, and I had another psychiatrist who treated only teenagers. So these are the two clinical specialties that we need to really nurture in the Ministry of Health. Psychologists and psychiatrists who focus on elderly care, and geriatricians who look after old people.
Most certainly. And also there's a vast body of research growing that shows that poverty and living in dire socioeconomic straits actually does increase the incidence of mental illnesses developing in those already predisposed.
But if you look at the Blue Zones project, 4 out of the 6 countries are actually from the lower socio-economic status, and yet they are very healthy and having healthy longevity.
So it's speaking more about that community intervention aspect and the socialization. Dr. Halimatus, if I could end by asking you about MyAgeing's upcoming carnival for intergenerational health.
Okay, so we are actually having a carnival, what we call the intergenerational carnival. So we would love to have a good mix of older persons and the younger population to have activity together. This is in conjunction with the IDOC, the national celebration of the older persons. And I would love to invite everyone to come over to MyAgeing, to celebrate together and participate together, socially engage. And yeah, everybody is welcome.
Wednesday?
On the 14th, that would be on Saturday morning, half day from 8:30 until 1 p.m.
Fantastic. So that will be right after, of course, the tabling of Budget 2024. Dr. Narimah, as well as Dr. Halimatus, thank you so much for joining us on Niaga Spotlight and sharing with us just a small aspect of some of the budget wish lists for the upcoming budget. Well, this has been Niaga Spotlight with me, Tamina Kausji. We'll see you next Friday with more business analysis and insights. Here's to a productive week ahead.